Good afternoon, sir. Today we will be assessing your heart and neck vessels. I am Nurse Aubrey, your student nurse from RDB of Fatima University. So, before we start po with the assessment, may I interview you muna? Okay. So, sir, do you feel any chest pain po? If meron, saan po banda? Kung gaano po patagal sumasakit or kung gaano po nakasakit?
Yung part wala naman.
Okay. So, do you experience po palpitations or dizziness or swollen ankles?
Hindi naman po.
Okay po. So, sa past history niyo po, meron po ba kayong previous heart problems, heart defect, murmur, heart attack?
Wala naman.
Sa previous diagnosis po, rheumatic fever, hypertension, elevated cholesterol, diabetes, or mellitus?
Wala rin.
Okay po. Nagkaroon po ba tayo ng heart surgery or cardiac balloon inversion?
Hindi po.
Okay po. Sa family history po, may family history po ba tayo ng hypertension or myocardial infarction, coronary heart disease, elevated cholesterol, diabetes?
Hindi po.
Okay po. Sa lifestyle po natin, naninigarilyo po ba?
Hindi po.
Ano po yung usual diet and exercise patterns natin? Sa ano po, umiinom po ba kayo ng alcohol?
Hindi po.
Yung sa sleep routine nyo po, gumagamit po ba kayo ng extra pillows tuwing natutulog?
Hindi naman po.
Nagigising po ba kayo para umihi, tapos feeling nyo, ano pa rin kayo, pagod pa rin?
Minsan po.
Do you use any medications or treatment po for heart disease?
Wala naman po.
Nag-self-monitor po ba kayo ng heart rate or blood pressure?
Minsan po.
Did you do any screenings po for blood pressure, cholesterol, or ECG? Okay po. So now let's move on with the assessment. So before we start with the assessment po, let me sanitize my hands first. Okay, sir. So before we start with the assessment po, I will explain the procedure po sa inyo. First po, I would auscultate for carotid arteries. Next, palpate each carotid arteries po. Inspect the jugular venous pulse. Measure the jugular venous pulse. And that's all po muna.
Okay po.
So before we start po, sir, may I ask you po to remove your t-shirt para po ma-inspect po natin na maayos yung heart rate vessels. So now I would auscultate for the carotid arteries of the patient using my stethoscope. So to auscultate the carotid artery of the patient, you would use the bell of the stethoscope. So hold. The other side. Exhale. Hold. So, sa pag-auscultate ko po ng carotid arteries niya, naririnig ko naman po yung pulse niya without any restriction. Next, I would palpate for the carotid arteries of the patient. Next, I would palpate for the carotid artery of the patient. So, using my index and my point finger, I would palpate for the carotid artery of the patient. Now, moving on, I would inspect for the jugular vein of the patient. So, to do that, I would ask the patient to lay down on a supine position. So, sir, I'm laying you down po. So, now I'm gonna ask the patient to turn left, his head left. So, here I would inspect for the jugular vein of the patient. So now that the patient is in supine position, I would ask the patient to turn his head left and then look for his jugular vein right. Sir, please turn your head left. Okay. So, next that I'm gonna do is to inspect for jugular venous pulse. So, here it is. And next is I would measure. Next is measure is jugular venous pressure. Next is the physical assessment on the heart or the pericardium. So, sir, now you can sit down properly. Okay. So, for the assessment of the heart, I would first palpate for the apical pulse. So, when I'm done palpating for the apical pulse of the patient, I would now start to palpate for abnormal pulsations or vibrations at apex, left sternal border, and base. So, sir?
Now, using the palmar side of the hand, I will palpate. I'm gonna start with the apex, then the left sternal border, and then to the base.
So, as I was palpating for abnormal pulsations or vibrations at the apex, left sternal border, and the base of the patient, I didn't feel any pulsations or vibrations on that areas. So, now let's move on the auscultation of heart sounds for rate and rhythm, apical and radial pulses, pulse rate deficit, and S1 and S2.
So now I was auscultate for heart sounds and heart rate, rhythm, apical and radial pulses, pulse rate deficit, S1 and S2. So now using my stethoscope or using the diaphragm of my stethoscope, I would put it on the apical pulse of the patient to auscultate. So while auscultating the patient, I have auscultate no pulsation, irregular pulsations or vibrations around the apical area. So while I was auscultating and the apical impulse, the patient's heart rate is 72 beats per minute, which is normal with regular rhythm. Remember that irregular rhythm such as sinus arrhythmia when the heart rate increases with inspiration and decreases with expiration may be normal in young adults. And resting pulse rate or RPRS varies with age, gender, and ethnic or racial factors. If you detect an irregular rhythm, you have to auscultate for a pulse rate deficit. Now I'm gonna show you how it is done. You have to palpate the radial pulse while you auscultate the apical pulse. Then you count for a full minute. The radial and the apical pulse rate should be identical because if it's not identical, then it is not normal. So now I'm going to auscultate the entire heart area. Again, using the bell of my stethoscope, I would put it on the heart area of the patient. So the entire heart area is normal and is functioning well. I didn't see any disturbance in the rhythm or the pulsations on the heart. So now I'm gonna auscultate with the client in the left lateral position and with the client sitting up, leaning forward and exhaling. So now using the diaphragm of my stethoscope, I would now auscultate the client in the left lateral position and with the client sitting up and down while the client is exhaling and inhaling. So while I was auscultating, I didn't see any abnormalities. But if there are any signs of abnormalities, we want to refer the patient to a other healthcare provider for further evaluation. That would be all. Thank you for participating with the assessment.